I'm Dr. Julius Hyatt from MaxilloSoft. I want to show you a full version of doing a third molar consultation utilizing our EMR program. Okay, so we have Antonio Nelson. He's been waiting 21 minutes for his appointment. We got him in. Usually the assistant's going to tell us why the person is here. They'll have something filled in, maybe wisdom teeth. Person's asymptomatic, maybe they're symptomatic, they're having pain and swelling. Their history of present otherwise unremarkable. It's been present for the last couple days, or duration of symptoms has been 3 weeks. So things you can choose like that. If they've had any prior treatment, let's say somebody gave them some antibiotics, some amoxicillin. And then part of the medical history, this is all imported from their thing. They have asthma, they have no prior surgeries, besides the antibiotic, no prior medications, no allergies. But you can record all that or review all that with the patient as you go. If you go to your physical exam, a lot of the assistant will provide you, usually do your vital signs ahead of time prior to me walking in the room. We can talk about either using shortcuts, which I've shown in a prior video, but here I'd like to just show you a complete, filling out of things. So if you're gonna do your normal exam, the person's alert and oriented, they have a normal looking head, their skin is healthy, TMJs are within normal limits, their normal opening, their eyes, ears, and everything appear to be okay, nose is clear, neck is soft, good mobility, no lymphadenopathy, trachea is midline, all this stuff you can have. Oral cavity, no pathology necessarily. Let's say we're talking about wisdom teeth. We can click those wisdom teeth, submit that, and this will take us to the page describing the teeth. Let's say they're all impacted teeth, full bony impactions. So we're going to go back to our physical exam and finish that out. And you can choose to fill out the entire physical exam or just record the teeth. It's really up to you. It's nothing's going to demand you do all that or not. Healthy periodontal dentition, mucosas within normal limits, labial mucosa, lips are fine, hard palates within normal limits, soft palate, tongue, no lesions, floor, mouth, all this you can choose to have it or not. Frenums, no problems with the pharyngeal wall. Let's say if they have class 1 occlusion, salivary glands are normal. We have a Panorex for this patient, but it's unremarkable. Cranial nerves are within normal limits. Their Malpati scale, maybe they're a 2. They have two level terms of their size of their tonsils. Then we'll go to the assessment, and here we have our teeth lined up. We can select one or all. Usually I select all, and because we're only going to do one thing with these things, and that's extract them. You apply that. That'll take us down to our treatment plan. And here are, since they were all complete bony impactions, we all recorded that, so it records their the dental code for extractions. And usually in the lowers, I'm putting a socket medication like tetracycline gel foam. That's just what I personally use. And that's our listing of what we've recorded. We go to a summary page. I've already used the shortcut for general anesthesia if somebody's going to sleep or they're ASA1. Or you can use local, how many units you want to use. A lot of times insurances want to know, well, if you're selecting general anesthesia, there's a rationale for that. So a lot of times it's their anxiety level is severe maybe, or they're infected, or maybe there's complex surgery, complex procedure. So all those things give you extra ammunition when the report goes to the insurance company. This is all recorded in there, so the insurance company will look at that, and if there's an issue or question, they can have that. Oftentimes I'm reviewing this with the patient's mother or dad, or maybe both. The specific risks, you can line up what you discussed or what you didn't discuss. If you use one of these shortcuts, it already pre-populates that. Your alternative is doing nothing. We give it the patient's pre- and post-operative instructions, as well as instructions for general anesthesia, which include nothing to eat or drink, and responsible adult with them to drive them home. Hitting the schedule appointment, that's going to forward now to the front desk. Again, we have our preliminary estimate, which shows everything that I've already labeled and fees and everything, so I kind of know that I didn't miss anything. When I used to have a scribe, this always got missed or was listed wrongly and incorrectly, and then this also, everything's added up. There's no need for a calculator, so you don't have to worry about the people in your office who can barely put people on hold using a calculator. So that just tells me basically if I've done everything, and then I get a report. Well, here's the treatment report, and obviously it's much more legible than anything I could possibly write. It's comprehensive. It's got everything we included. Again, it's going to have whatever you include or whatever you choose not to include. It's all right there, and it's a good-looking report, and this is legitimately done, and it just provides an excellent method of documentation for your patient. So with this report, this will go to the insurance company, and we've definitely seen our improved turnover and return of insurance claims much more quickly, because we have a legible report that includes the information that the insurance companies are asking for. For instance, we did discuss the person had anxiety level, which was severe, and infection or maybe complex surgery as justifications for general anesthesia. So that is there, and there shouldn't be any questions or problems when it comes to, well, why'd you do anesthesia for this patient or not. So just a good method of recording and legible, and something you can use for your insurance justification insurance use. Okay, so in summary, I just want to tell you, we built this system for us. We thought we were very, very busy. There was very little we could do to improve what we were doing, but this system has really made us better, faster, much better documentation, much better, it gives us more time to pay attention to the patient care, and our insurance reimbursements, because our notes are so much more clear, concise, legible, and supply the appropriate information, we're getting much better results on the insurance end, which is not the whole reason why we did this. So in end, I would never go back to do anything the old way. This is the only way to do things, and I think you should consider this product seriously for your practice.